Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in this series of the videos, Eye Problems in General Medical Practice. This is very useful for the new doctors. This is ophthalmic problems in general medical practice, that is GP. Myself is Professor Dr. R. Deshpande, would like to welcome you all in my Ayurveda Academy channel. I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For communication, my WhatsApp number is 922-681-0630. So we are going to discuss many eye problems. But before that, you must know what is exactly the eye. Eye is like a camera. Okay, so the light rays are coming through the cornea, which is a transparent, then it passes to the lens, is lens like a camera, and then it is coming on the retina, where there are rods and cones which are very photosensitive type of the cells, and then that particular light signal goes with the optic nerve to the brain, and you get the knowledge or understanding of the vision. Okay, so these are the eye problems that I am making a series. So Sky Challenge I have already uploaded. Today we will discuss about blepharitis, conjunctivitis, spring catarrh, and the next videos will be about acute dacryocystitis, senile cataract, corneal ulcer, xerosis, and Bitot spots. So there will be 3 videos regarding the eye problems in general medical practice. So let us start with the blepharitis. You can see this is an eyelid. So inflammation, infection to the eyelid is called as blepharitis. Remember this word, my dear students and doctors. ITIS always indicates the inflammation. Okay, so margins of the eyelids are red and swollen. Many scales, it is very important, many scales at the base of eyelashes. This is a chronic condition. This is not at all acute like conjunctivitis. Okay, ask the patient to remove the scales. This is the home remedy with the wet handkerchief before applying the ointment. You must clean it. Cleaning is important before application of the ointment. Rub Neosporin, this is antibiotic, Neosporin H with hydrocortisone eye ointment on the lid margin. Repeat the procedure 3 times in a day for minimum 15 days. Okay. Now next is acute conjunctivitis. Blepharitis disease is finished. Only one symptom and simple remedy of application of ointment. Okay. Now conjunctivitis. What is conjunctiva? It's a mucosal lining on the palpebral conjunctiva and also on the middle part. Okay. So redness, watering, and foreign body sensation in the eye is a specialty of conjunctivitis. These 3 important symptoms: redness, watering, and foreign body sensation. Then there will be also mucopurulent discharge, due to which eyelids stick together when the patient wakes up in the morning. Especially this can happen with the children also. So they complain when they get up in the morning, their eyelids stick together because of this mucopurulent discharge. Okay, keep patients' towels separate because this is contagious. So one person, if use the handkerchief and another person, that person will also get the conjunctivitis. So be careful. It can spread from one child to another, one person to another. So keep your towels or handkerchief, anything very, very separate. Clean it with the boiling water and putting some Savlon or the Dettol. Not to be this handkerchief of the patient, this towel of the patient should not be used by the family members. Okay. So this you can see here. This is redness and watering. Can you see? This is the conjunctiva. This is the conjunctiva. Okay. Acute conjunctivitis, very acute. Last day it was not there, but today it is there. So within hours or within a day, okay, if only one eye is affected, right or left, prevent the infection to the other. This is very important by lying on the affected side. For example, if my right eye is affected, I should sleep on my right side. If my left eye having the conjunctivitis, I should sleep on the left side. That is correct. Use the dark goggles if there is a photophobia. You cannot bear the light, tube light, sunlight, anything you cannot bear. Then put the black goggles. Wash eye with the boiled and cooled water before installation of eye drops. That is very important. Cleaning is also important. Wash the eye with the boiled and cooled water. Then you have to put either genticine or ciprofloxacin or norfloxacin eye drops every 2 hourly. Every 2 hourly. That is very important because this is acute conjunctivitis. Can you see uninflamed conjunctiva? This is uninflamed conjunctiva and this is inflamed conjunctiva. Acute conjunctivitis treatment, avoid the antibiotic plus steroid eye drops. I am not saying antibiotic. Antibiotics plus steroid, it should be definitely avoided because infection can flare up with using the, if it is only allergic, then don't use antibiotic. Only steroid eye drops is okay. But if it is infective, then better use the antibiotic eye drops without steroid. Okay. For example, chloromycetin applicaps. Small tubules are there. You have to cut it and put the ointment at bedtime while going to the sleep. In severe cases, when there is a too much, mostly it can be the viral. But if it is a typical bacterial, then better way capsule mox 500 milligram 3 times in a day for minimum 5 days. It should not be stopped abruptly. Otherwise, antibiotic resistance can take place. Tell the patient this fact because many patients just taking 1 or 2 or 3 tablets, they stop the tablets of antibiotic or capsules and then there is a resistance to that particular antibiotics. This is a very old generated and very powerful medicine. It is amoxicillin. Okay. In an epidemics, it is easy to rule out the conjunctivitis because there are in the neighborhood, there is maybe conjunctivitis patient. In the school, when the child is going to the school, his classmate may have the conjunctivitis. So you will definitely ask the history if there is a contact with the conjunctivitis patient because it can spread from one person to another. Okay. Then otherwise, always ruled out, there is also danger. This disease is danger. Iridocyclitis. Iridocyclitis. One time I will discuss what is iridocyclitis and how it should be differentiated from conjunctivitis. There are many audios on my channel. Remember about the ophthalmology. Those are audios, very fantastic. And I have discussed all this with the only audio, not there is no video, there is no slides, but you can hear by putting that your earphone, and that are very good audios of ophthalmology or eye problem. They are very useful for the students of the last year BAMS because those all audios are as per syllabus diseases. Okay, next. Then there is angular conjunctivitis, only at the angles, erythema of the conjunctiva at the angle of the eye, along with eczematous condition of the skin near the canthae. You know, this is inner canthae, this is external canthae, inner and outer canthae. Okay, so there may be little bit outside here on the skin, there may be some erythematous condition, red color will be there. This is angular conjunctivitis, is not acute, it is subacute infection caused by the bacteria. This is also contagious, spread from one person to another. What is the treatment? Zinco sulfa eye drops 4 times in a day, QID, 4 times in a day, 8 a.m., 12 noon, 4 p.m. and 8 p.m. 4 times in a day. Neosporin H eye ointment, BD 2 times in a day, apply inside the eye as well as to the affected skin near the angle of the eyelid. Okay. If no response, then in addition to these drops, you can replace zinco sulfa by pyrimon eye drops, QID 4 times in a day in 1 week. Next disease, we have completed blepharitis, then conjunctivitis. Now I am talking about spring catarrh. Okay, this is a chronic. First conjunctivitis was acute. Angular conjunctivitis subacute within 3, 4, 5, 6 days. And this is chronic, repeated attacks every year. During the spring season, chronic allergic conjunctivitis seen in the young individuals comes in the summer and disappear in the winter. Okay, last for several years and subside automatically, spontaneously. What are the symptoms? Burning sensation of eyes with intense itching whenever there is allergy. Remember my words, whenever there is allergy of skin, eyes, anything, itching is predominant. Pruritus, another word, pruritus, Pruritus. Itching or pruritus is very common in any allergy conditions. Is it okay? Then itching will be there. Profuse lacrimation. Profuse lacrimation. A lot of lacrimation will be there. Okay. What to be done? It is allergy. So naturally steroid, pyrimon or Dexaber C or Sofracort, antibiotics plus steroid, or genticin HC, hydrocortisone. Gentamicin plus hydrocortisone, that is genticin HC eye drops 4 times in a day. Okay. Fintal, 2% eye drops, only 1 drop 4 times in a day. And then anti-allergic tablet internally, tablet Lorfast 10 milligram or tablet levocetirizine 5 milligram only once. But better way, you give this anti-allergic tablet at night only. Remember my words, anti-allergic tablet should be given of allopathy only at night. If by chance you want to give in the morning, in the afternoon, after lunch, then better ask the patient, don't drive. Now, even no swimming, not going outside, because there is a little bit side effect that drowsiness can take place. The patient feels sleepy, and in sleepy, if he works with the machine, if he works with near the fire, if he works near with the water, there may be mishap. So whenever you are prescribing anti-allergic, better way, give it at sleeping time. If you give the morning time, tell the relatives, tell the patient, there may be some sleepiness, there may be some drowsiness. Don't get afraid. Don't call me, oh doctor, he is sleeping, he is falling, he is fainting. No, this is a side effect of anti-allergic drugs. Now, these latest drugs have very less sedative effect. Previously, when we were using Avil, tablet Avil, chlorpheniramine maleate, CPM tablet, then drowsiness was much more. Now, these now next generations of anti-allergic drugs, they have very less sedation. Okay. Spring catarrh caution. Do not prescribe steroid eye drops continuously. This sentence is not completed. Do not prescribe steroid eye drops continuously. This is complete. For more than 3 weeks. Never. Steroid eye drops in the eyes should not be used more than I am not saying don't use it. I am saying not more than 3 weeks. Okay. Whenever, without review by specific MS ophthalmology. Ophthalmologist should say, no, continue. Then only you continue. Otherwise, general practitioner should not use these steroid eye drops more than 3 weeks. This is all about today's small 3 discussions. What we have discussed about the Blepharitis. Then we have discussed conjunctivitis. And then we have also discussed the different types of conjunctivitis, like for example, angular conjunctivitis. All these things we have discussed, but these are the educational videos. So don't use any medicines by self medication is not recommended. कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्य की सलाह लेना बहुत ही जरूरत है. If you are suffering from any chronic disease like arthritis, MND, motor neuron disease, cancer, and attention deficit hyperactive disorders, idiopathic thrombocytopenia, ED, ejection, what you can say, the erectile dysfunction, any sexual problems as well. You can have chronic immunological disorders. Ayurveda Academy has a different expert doctors. You can contact me on WhatsApp 9226810630. I request all of you like this video, share this video, and don't forget to subscribe my YouTube channel and press the bell button icon to get the information of the new upcoming videos. Okay. Thank you very much. And I wish you all the best. Take care. Bye-bye.